Every few years, a new branch of medicine emerges. Usually, this comes out of a marriage between a new technology and a medical need. What I'd like to talk about today is clinical kinetics. In biology and biochemistry, unfortunately, mostly what we measure is what can be called static rather than dynamic or kinetic measurements. If you measure how much cholesterol you have in your blood or you measure your blood sugar, that's just telling you what the concentration is at any single moment in time. Kinetics have to do with the rates of things. For example, if you turn on the radio to learn about the traffic, you don't want to know how many cars are sitting on the bridge or on the highway. You want to know if they're moving and how fast they're moving. Same is true in biology. If you want to know how fast a cancer is likely to progress, you need to know how fast the cancer cells are dividing. So knowing rates is a much better way to predict the future, or to put it differently, to know the trajectory of a disease. So measurements of the rates of chemical processes is exactly what's been missing from medical diagnosis, patient management, and drug development. Kinetics has been developing a new technology involving mass spectrometry, which allows the measurement of rates of important chemical processes in living humans non-invasively in a routine way. To learn very quickly whether a medicine is working, and in a drug trial to learn before a long, slow clinical outcome happens whether the medicine is likely to be effective. So clinical kinetics is a fundamentally different kind of technology, and it provides a fundamentally different class of information for doctors, patients, and drug developers. I think it's important to emphasize that Kinetics has been at the forefront of developing this new technology, which has resulted in this new branch of medicine, clinical kinetics.